Feeding Southwest Virginia was founded in 1981. And so in May of 2021, we will be celebrating our 40th anniversary in our fight against hunger. If someone would have asked me 40 years ago, would we still be in existence, or would we be providing more food today to our neighbors than we were 40 years ago, I would not think that there would be such a great need in the days that we're living in. We had no way to know that not only would we struggle economically in 2008 through 2012 in far Southwest Virginia, but now we're responding to the disaster of the pandemic and responding to economic challenges of our neighbors in our 26 county area. We do serve 26 counties and 9 cities in far Southwest Virginia. That's 12,400 square miles. And 10 of the poorest counties in the state are actually in Southwest Virginia. And over the years since 1981 that I've traveled through our 26 county area and into some of the remote rural communities that we serve, it's been very challenging for our organization to be able to find adequate resources to reach all those individuals that live in those communities. And then to provide extra resources in times of economic downturn and plant closings and layoffs. So without the interest of citizens, individuals, and corporations and great partners within our service area, like you that have joined us today, we couldn't provide the services that we provide, and we would not be able to find enough food or to be able to move that food through our logistic system to feed as many people as we feed together. So today, as I start this town hall, I just want you to know how grateful I am that we have such generous and compassionate people in our service area that help us in the fight against hunger. We have 146,000 food insecure individuals, including in that number is 40,000 children. And we know that children have a special place in our heart, and we work really hard in our children's programs department and all of our team here at Feeding Southwest Virginia, and some of our supper partners and other donors contribute to these programs monthly to help us feed children. We also have a special place in our heart for seniors. We've been doing a lot of work recently during the pandemic and partnering with senior programs, knowing that seniors are at great risk right now regarding COVID-19. And so being able to work with many programs that provide food directly to seniors in their homes has been a great blessing for us and for those seniors. We have 2 distribution centers where we actually distribute $34 million worth of food a year. And we have our distribution center here in our facility in Salem. And then we have a distribution center in Abington to serve the far Southwest Virginia. Within our Abington Distribution Center, we have our Harvest Home Kitchen, which is basically a meal program to go. We recognized early on that there weren't as many meal opportunities in far Southwest Virginia that they were in some of our other service areas like the Roanoke Valley or New River Valley or some of the other regions. So we developed this program, and basically what happens is we take food that's donated from some of our food partners, and we purchase additional food, and we have volunteers that come into our kitchen and they actually prepare those meals 3 days a week. That go out to individuals. Most of those meals do go out to seniors and programs that deliver to seniors. However, in the summer, we provide additional resources and meals for children. We have our children's feeding kitchen now in Abington, and that program was actually launched right before COVID, and temporarily we had to shut it down for a few months. It's back up and running, and actually that program prepares fresh nutritional meals that is delivered to children's programs down in Southwest Virginia near our Abington facility. And then we have our Community Solutions Center on Melrose Avenue in Roanoke City, and that program there is actually a program that provides culinary arts training, meal production training for students. We also are now, because of COVID-19, we've been distributing meals to go for children from that facility there on Melrose Avenue, as well as senior boxes. Nutritional food for low-income seniors is now being distributed through that center as well. So we've been able to use the Community Solutions Center as a direct service site during COVID-19, and has helped us get food to children in the Roanoke area of Northwest Roanoke, and as well as seniors. But also that site prepares meals that go out to the libraries in Roanoke City, as well as other after-school programs and evening programs for children. We, most of our food, our $34 million worth of food that rolls in and through our system actually goes to 370 nonprofit feeding programs, our partners that are in our 26 county, 9-city area. And they are true heroes that are in those communities working sometimes once a week, sometimes once a month, providing food directly to individuals. And they are church food pantries, emergency shelters, senior programs. There are all kinds of different programs that we work with to directly provide food to those that are struggling to put food on the table. And they are a great network. It's our charitable food distribution system. Together, and when I say together, I mean you that have our donors and those of you that have volunteered or partnered with us, as well as those 370 agencies with our volunteers, and then with our team here at Feeding Southwest Virginia. Together, we provide food to over 100,000 individuals every month. And so you know, as I stated, 146,000 people are food insecure in Southwest Virginia, and together we're serving food to over 100,000. There's a gap there. There's still a gap. 40 years ago, I wouldn't have thought there would still be a gap in Southwest Virginia. Our vision was to reach every hungry person, provide every struggling family or every senior who doesn't have adequate food resources, or every child food. Unfortunately, there's still a gap, and because of that gap, we continue to work to educate, like today, provide awareness, but also let our partners know what we're doing, what our needs are, and what the future looks like. So that's what we'll talk about here today. I want to speak a few minutes about our work during COVID-19 and the pandemic. And how that we have been able to provide resources during a time of high health risk and unemployment due to closings and to furloughed employees, and just to people that are anxious and scared. And we are a disaster organization. We always have responded to disasters, floods, hurricanes, wind disasters, snowstorms, but this is different, and we all know this is different. It's different because of the health issue that's very concerning throughout our Commonwealth and throughout our service area in Southwest Virginia. However, we were quickly able to mobilize because of our experience and our 40 years of boots on the ground and working with so many partners, and having the opportunity to work with individuals and companies that provided additional resources. We were able to get out a lot of food in a short period of time as we mobilized. Just as we have seen and know, there were empty shelves in the retail stores and in some of our pantries. we were actually calling on you and calling on our communities to help us get additional food resources. And we were able to do that very quickly through Feeding America, the national organization, and through the government, as well as our local retail partners and other partners that have helped us through the years secure food to feed people. But this was the first time in our history that we were unsure we could meet the need. Based on the urgency and the crisis, we projected in 2 weeks we would run out of inventory, and mobilizing quickly, and the response from some of you as well as many others, we were able to start direct distributions in communities where there was high food insecurity, where there was high unemployment numbers, where there were agencies, but they didn't have the capacity to move the perishable food that we were getting in and back out our facilities so quickly. So we were able to begin to develop some partnerships and expand existing partnerships like the LOA, and with some of the children's feeding programs like the Boys and Girls Club. Not only did we provide food for the children, but also boxes of food for their families. So we were able to use our existing structure and our great partners that have done this 365 days a year, and for other new partners that were just getting into this food provision process during the pandemic. And then there were additional resources through the federal government to provide the USDA food shipments that we began to get in and to distribute out rather quickly. I will say that we have worked with all of our national and with all of our state and all of our local elected officials and representatives to be able to get as much product and resources we could through our distribution system and out to the communities and the neighbors that we help. And so our pop-up distributions were very successful. We were able to bring truckloads of food. Already we provided over 20 of these pop-up distributions in communities throughout Southwest Virginia. We were able to do that because of our mobile food pantry program that for Southwest Virginia that we have been operating for over 8 years, where we actually roll a tractor trailer load of food into 12 sites every month to directly provide food to individuals straight off our truck, working with community partners and being able to meet the need in some of those most challenged economically and resource challenged communities. So because of our experience in operating that type of food distribution direct model, we were able to rather quickly develop our pop-up system, which was a no-touch distribution, where we basically work with volunteers and our team, and we go into the communities, and we have cars that actually line up 2 to 3 hours prior to the distribution, several hundred cars at a time, and usually we provide food to about 1,000 individuals through each one of those pop-up distributions. And so by doing that, and through those 20 pop-up distributions, we were able to feed over 19,000 individuals and our neighbors in these communities through that pop-up distribution model. We will continue to do that. We have 4 additional pop-up distributions. And if we continue to get, and we hope we do, an abundance of product in that's perishable and needs to get back out into our communities, we'll continue to do that work as well. I would like to talk a little bit about our children's feeding program. What a unique challenge, but opportunity that was for us. The school system, the Virginia Department of Education, and the schools have done a great job in every community that we serve and represent of feeding the children when they were not in school, and reaching them through various ways of getting from the bus drivers taking the food out and the children meeting them at their bus stops to various other distribution models. The school system's done a great job. So what we did was we worked to complement what they were doing, and then to work to fill the gap where there were areas they could provide the services. So unfortunately, the statistic for us in Southwest Virginia is 1 in 5 children face food insecurity. And we just feel that's a shame in a country with such abundance. And so we've worked very hard to try to find diverse ways to reach all the children in Southwest Virginia in every community that we serve. And so it complicated things for our children's feeding programs, COVID-19 and the pandemic. We immediately had to shut down the programs we were currently operating in the spring, and we had to reopen programs that would work in the environment of safety and as well as emergency food distribution models. So we were successful in working with additional programs, new partnerships in our existing children's feeding sites. We were able to provide 250% more meals than we were in the previous year. And we all know how challenging it's been to just operate in some normalcy during the pandemic, but we actually were able to work with our partners and go way beyond what we thought we could initially, and we were able to reach children in different ways. And an example of that is our Community Solutions Center. We quickly organized that as a direct Meals to Go site to be able to provide meals to children in Northwest community of Roanoke City. And so we were able to distribute 11,000 meals to go for children as part of this emergency response, as well as working with all those other partners that we had during the period of time. We also were able to support 40 backpack programs last year, serving approximately 5,000 children, over 4,800 children per month through the backpack program, providing nutritious food, again, for children that need it during these tough times. Then something I would like to share with you that we have been planning and hoping to implement for at least 15 years at Feeding Southwest Virginia was fresh, nutritious meals for our children's programs. We initially, when we started our charitable food distribution network in Southwest Virginia 40 years ago, we were focused on getting as much food as we could to food insecure families within our region. And therefore we had to delay some of the other work we knew was absolutely necessary, which was providing nutritional food and specifically to children. So we were able to launch in the last couple years 2 kitchens that work very hard with volunteers and with learning students to provide those fresh nutritional meals. Our Community Solution Kitchen has served and sent out over 37,000 fresh meals for after school children's programs and 19,379 meals for our summer feeding sites. And we also have our Cafe to Grow, which is basically a foodie truck for children that rolls directly into communities that offers fresh meal options for children in those communities that may not have an opportunity for a fresh meal through another program. But in February of 2020, with some state funding and support through the Department of Social Services and through donors in the Abington facility and with our partner Food City, we were able to open our new children's feeding kitchen out of our Abington distribution center. And we know down in that far southwest region, there's even less opportunities for children to have fresh, nutritious meals for programs. And so we were very proud to be able to secure that funding and to work with a number of partners and donors to provide more than 5,000 hot meals to children in Southwest Virginia. And particularly since each school district determined how they were going to implement their educational program, whether they were going to be in school or they were going to have their students to participate virtually was a challenge to try to determine how that was going to work and how we could best serve children in those communities and supplement what the school systems were doing. Also, I mentioned previously, we have our Harvest Home Community Kitchen in Abington, which we've operated now for over 15 years. And we have volunteers that come in, and we actually reduce food waste by picking up from restaurants and catering services and from some of our local food partners. And we turn that food into 100 to 400 hot meals 3 times a week, and they're to-go meals. And that's why a lot of individuals come, or community organizations come to pick up meals for seniors, and so that they can have hot, nutritious meals as well. And currently that's a drive-through style. Individuals, our neighbors, pull up in the parking lot there at our Abington facility, and then volunteers actually take out those meals to individuals and our neighbors that are in those vehicles, and then they leave our facility. We feel good about the fact that we've been able to do some expansion and some work around some very necessary programs, despite the challenges we're all facing during this year of 2020. A lot of people want to know how we are able logistically to provide food, $35 million worth of food every year to 370 partners, and then our own direct feeding programs through Feeding Southwest Virginia's team and volunteers. And we're able to do that because we have a fleet of tractor trailers, smaller trucks, and vans that are actually Meals on Wheels, not the senior program, but basically groceries on wheels, or hot meals on wheels that roll out to our communities every day, 5 days a week, and sometimes on weekends, serving our neighbors food, whether it's grocery items or whether it's meals. We continue to roll every day. We've not been allowed to really shut down or to shelter in place during this pandemic. As a disaster relief organization and essential business, we have to be there for our neighbors that need food during these struggling times. So our mobile food pantry, which I mentioned previously when I was talking about the model that's worked so well over the years that we were able to utilize and replicate for our pop-up distributions. Our mobile food pantry serves 12 communities every month. We have an average of 150 to 200 individuals at each location that come to get their groceries, and that's over 24,000 individuals or our neighbors that we're feeding together. We're feeding together annually, and that is the only food source that many of those individuals have in those rural, remote communities of, of charitable food or food donations. That's the only opportunity they have to receive these types of groceries. And sad to say, but it took us 30 years to really logistically figure that system out, and then to identify and secure the resources necessary to be able to reach 24,000 people a year through this system, and then in our remote regions. Our mobile food pantry truck, it travels over 1,600 road miles every month to meet the need within those regions. And we're so grateful to the United Companies and to other funders that really helped us launch that program, and to continue to mobilize communities in order to feed their neighbors and their communities there in those locations. Now, we know that volunteers are actually the secret sauce, we call them, at Feeding Southwest Virginia. And that's because to distribute $34 million worth of food, that's a multi-million-dollar food business on a nonprofit budget of a little more than $4 million. We do not have the working capital. We do not have the capacity nor the resources to hire enough staff to make food happen for over 100,000 individuals every month. So that's where our volunteers come in. That's why we so desperately need the volunteers. And during the pandemic, you know, we temporarily had to shut down our volunteer opportunities until we could figure out how to do that safely and how to reorganize to meet the crisis and the disaster response, as well as our ongoing programs. I will have to say that most of our 370 partner programs that are true heroes every day, every month feeding people, most of those organizations stayed open. And they're volunteers, and most of them are volunteer driven. They don't have a lot of resources to hire a lot of staff. They came into their organizations and they provided food to individuals despite some of the health challenges that we all are facing. And so kudos to them, and we really value their partnership and the work that they do. Also early on, we were able to secure gift cards for some of the school systems in the Allegheny Highlands. When the schools closed down, we knew immediately meals closed down for children. And before the schools could reorganize and determine how they were going to serve those children, we were able, through our retail partners, we were able to get much needed gift cards for the families to be able to get additional food. And then the United Way in Southwest Virginia was very generous working with their donors, and were able to provide gift cards for us to be able to distribute to our partner agencies for individuals so that they could go to the store and buy the necessary groceries they needed to feed their families until we can get adequate food resources into our facilities and through our rolling fleet out to our programs and to our neighbors. And so by doing that, we were able to respond in different ways. And that's what we're looking at as an organization when we think about how do we not only distribute food and fight hunger, but how do we fight hunger smarter? How do we fight hunger differently than we did 10 or 15 years ago? And so we have developed some innovative programs, which I've shared with you this morning through our Cafe to Grow and through our two children's meal production kitchens, and through our emergency package of boxes and our senior packaging of our senior commodities that we distribute to low-income seniors every month. You know, one of the saddest stories I've ever heard was a family that shared with us that they were in the grocery store a number of years ago, and there was this elderly couple that were shopping, and they just happened to overhear the comment that was made by one of the seniors that they were going to have to purchase some pet food because they didn't have the resources to purchase food to prepare for them. And we also know, and we have some other stories that we've gathered over the years, but one of our own staff members was in the ER a number of years ago with his wife to be treated. And in the next bed was a mother and her child. And the child was being treated for something, but as they were getting ready to leave, our staff member overheard the child ask his mother if they could stop and get something to eat on the way home. And she responded, you know, I'm going to have to take all the money and actually buy your medicine with it, and we have no money for food. And so we hear those stories all the time, and we know that you do, and that's why you're on this call today, is because you really care about people. But recent stories that we've heard during the pandemic, we had a mother to share with us as she came through our pop-up distribution in Franklin County in November. She said, I'm a stay-at-home mother and I'm doing all virtual school for my child. And with the cost of groceries and living going up, we are struggling. So this is really helping my family right now. and thank you to everyone that has made this happen. And so that's one of the purposes of these town hall meetings, is not just to educate you and to let you know what we've done with your investment. It's also to thank you and to let you know and to share what we're hearing that you probably don't get to hear, is from the grateful individuals and our neighbors that are experiencing food because of your generosity. Not knowing where your next meal is coming from or when you will be able to eat is scary, is what an individual said. Knowing there is a place that you can go to get help makes it less scary. And, you know, that's the first time that I've heard that word, that description a lot lately, scary. And we know that people are scared about a lot of things, but, you know, we know that being scared about not being able to feed your child or your family is just something that we can together do something about. I've had to go to a food bank, this neighbor said, which we've never had to do before. And I do know that one of our staff members has seen individuals, neighbors they know that has never been in a situation where they didn't have a job. And for the first time, they were having to set in our pop-up distributions for sometimes 2 to 3 hours to wait to get their groceries before they go home. And then one of our children's feeding stories is extremely important to share with you because I think this will touch your heart today, hearing this story. This food has helped our family so much during this time. My husband wasn't able to work because of COVID, and it hit our family of 5 hard. The snacks and drinks helped us so much because we could use that money toward our bills. And I want you to know that, you know, because of your generosity and because of our so many partners that have helped us through this crisis and have helped us in this fight against hunger all these years, that you're keeping people in their home by providing gifts for food. So they don't have to spend it on groceries. You're providing medicine to individuals that are ill because they can save that money that they would have had to have spent on a meal or on groceries, and they can buy their medicine. And we've heard many times clients have said, you know, I make a choice every day, medicine or food, you know, pay my utilities or buy food. But this truly helped and made this time so much better with a smile and no judgment. And I think that's important to understand, that people that need food come to our resources, come to our pantries, come to our partners and our direct programs, and they come with dignity. You know, they come because they need the food, and to be able to offer a smile and to be able to offer help during this time without people feeling judged or the need to be judged has just inspired me and our staff and our volunteers to continue to do our work. And so what lies ahead for Feeding Southwest Virginia in 2021? Well, we'd all, if we had the answer to that question, you know, we'd all have a lot of resources to help all the neighbors that are in need right now. But we are focused right now and strategically have already met with all of our elected officials nationally and regionally and within our state to focus on a sustainable food supply. We've had a lot of government resources recently with food help, and so we know that's going to diminish in 2021. And we also know that some of our food donors who have helped us over the 40 years don't have as much product to give us as they had at one time. So we're looking at different food resources and different ways to feed people at a lower cost. And so we're looking at some innovative programs next year in 2021 that you'll hear more about as we move into 2021, again, to get as much affordable and nutritious food to our neighbors as possible. And then we know that our vital infrastructure, we've talked about our fleet of tractor trailers and box trucks and our vans and our cargo vans and delivering vans for the meals. We have to keep those vehicles rolling every day, either to pick up food or to deliver food. So we want to continue to focus on that. Then we want to look at ways that we can expand our children's programs and our seniors programs, and for those that are ill, because we know going into 2021, we're still going to be dealing with a crisis, a pandemic, and some health challenges moving into the new year. I also want to just touch on, but won't speak a lot to this today, but we have been working very hard with healthcare partners for a number of years to provide food to individuals that struggle with chronic illnesses. From a previous survey a number of years ago, 69% of our neighbors that we provide food to had high blood pressure, and 43% of our neighbors had diabetes. So we know that there's a direct connection between poor food consumption and long-term illnesses. And so we have worked with healthcare partners. This year we launched our first ever food pharmacy, where we had referrals from healthcare and some of the health partners that we work with to provide food tailored toward certain preventative illnesses or treatment for certain illnesses. We have partnered with healthcare partners, the Health Wagon in far Southwest Virginia. We have done COVID testing during our pop-up distributions. We're getting ready in Roanoke to do a flu vaccine opportunity for individuals and our neighbors that are be waiting for that pop-up distribution to be able to get a flu shot if they need a flu shot. So we're grateful for the partnership and the healthcare that we've had to address food insecurity, and at the same time to address long-term health issues or illness. We also know, looking forward, unemployment will continue to be an issue. Underemployment will continue to be an issue. And we have many communities right now that have higher than state average unemployment. The city of Martinsville right now is over 11% unemployment. City of Danville is over 9%, almost 10% unemployment. Dickinson County in Southwest Virginia is over 7%. Tazewell County and Henry County, all three of those counties are over 7% of unemployment, and Pulaski and Wythe is over 6%, almost 7% unemployment. So we know that those neighbors are going to struggle for some time, and particularly during the winter months when the cost of living is a little higher due to fuel costs. And people typically in a normal year get sick in the winter and have higher medical bills. And we know that's probably going to be the case, certainly for this year. So again, I would like to thank you for all of your support, for all the help that you give to your neighbors, and for the compassionate heart that you have within you to not only give of time and resources financially and food, but to take time to join us today in sharing with you the important work that we're doing, some of the challenges that we're facing, and then some of the conversation engagement as we move forward in 2021. Now I'm going to turn it back over to Eric and for any questions that you might have for me this morning.
Thank you, Pam. Very informational presentation today. Ladies and gentlemen, if you have any questions for Pam at this time, you can type your questions in the chat box at the bottom of your screen. So I'm going to give it a few seconds here for you to go ahead and type those questions in there, and I'll answer them in the order we get them. Looks like we already have one question, Pam. It's what keeps you up at night when you think about this year and what's ahead?
I think, and someone had asked me that question early on, and I think what keeps me up at night, keeps us all up at night, and that's the struggle between living life in some normalcy, but yet taken great health risks to continue to live life in normalcy. And what keeps me particularly at this time in history where we are at night is knowing that myself and our team and our volunteers are putting ourselves at risk, even though we mask up and we do everything that has been given to us to do to keep as safe as possible. We have to balance health with food insecurity. And before, when we responded to disasters, we just responded to the disaster and we didn't have to worry about the health of our team, our volunteers, or our neighbors. We basically worried about getting resources to those individuals that were impacted by disasters. This particular pandemic and this disaster response has been, we have to worry about how that we keep ourselves safe, and then how do we meet the need.
Okay. How do you keep up your optimism? What makes you optimistic?
Well, I'm optimistic in nature, but I think that the service area that we have is the most challenged within our state. There's 7 other great food banks. Well, there's 6 other great food banks. There's 7 of us in the Commonwealth of Virginia. We all belong to the Federation of Virginia Food Banks. And it has been over the years a very daunting and challenging task to find enough resources to meet the need in far Southwest Virginia. And when you think about it, we have no food manufacturers in Southwest Virginia. So our food opportunities are very limited. So we are really dependent upon food outside of our region to meet the need. And then the resources. We saw in 2008, the decline and the closing of furniture, textile industries. We saw, our area was rich in tobacco industry early on, many years ago, and then the coal mining regions were shutting down. And so we had less resources than we did actually when we started this work. So those resources have continued within our service area and our region have continued to decline. But what keeps me motivated is the smiles and just what I read from some of the few people that I've talked about today that are really so grateful for the work that we all do together and the food that they get. And then I'm optimistic because I've always seen our communities come together and rally around an urgent need. And we've been able to get past all of the disasters, and we've been able to do more work together. And so if we weren't optimistic and if we weren't motivated and passionate about, I think my passion and the passion of our team, even after 40 years, I can remember a couple times in our history where I was ready to do something else, because I'm going to share with you, feeding people is not easy, not as easy as most people think it is. And sometimes in that process, you can get very complacent or very tired. But when there was a flood in Hurley, Virginia, down in far Southwest Virginia, many years ago, I can remember standing in Hurley to mud up to my knees, where they lost their only grocery store, their post office. They lost just about every business that they had in Hurley. And many people lost their homes. But the only food that 300 and some families up there got for 3 weeks was the food that was collected from the other food banks in the state. And then we trucked it up there to Hurley for 3 weeks for 300 and some families. And just to see the gratefulness of those families up there. Those kinds of situations are very dire and very can be very emotional. But when you see the great work that happens, when people come together and you see the generosity and you see the gratefulness, it just lets you know that this too will pass and that we can continue to do our work together.
We have another question here. Is a monthly donation preferred or a larger lump sum right now?
Wow, that's a good question. That's a very good question. You know, this is the time of year that we do get a lot of gifts, but we are asking, we have superheroes, because we found there are certain times of the year where people are more sensitive to others not having enough groceries or children not having meals. And that's generally Thanksgiving and Christmas. And so our previous years ago, what would happen is we'd get a swell of resources in Thanksgiving and Christmas, and we'd get very little resources the rest of the year. And we have to keep the trucks rolling, the fleet rolling, the food rolling, and the meals going out. And so we prefer monthly supporters, because that helps us know that we're going to have money coming in. We're private, public-private nonprofit. We're not a government organization, and we're not a chapter, like a local chapter of Feeding America. We're an independent nonprofit that lives off of the generosity of individuals and organizations in our region. And so monthly contributors are extremely important to our sustainability, to make sure that we can depend on those donations coming in. And so that's one of the great things about being a private public nonprofit, is the fact that we work with the government as much resources as they can give us, but we work with great individuals, corporations, and foundations and donors that support us and sustain us every day, 365 days a year, and sometimes for children, 3 meals a day, but a great donation as well. You know, a large gift as well is always excites us. You know, I can remember when we first started raising money many years ago, we had no money. Our organization basically had zero in the bank. And I can remember many times that we struggled to even pay our bills. And one of the things I've shared nationally is food banks like our food bank, like Feeding Southwest Virginia, in the region that we serve with little resources, make the same decisions that our struggling neighbors do. Do we roll trucks out? Do we spend money and fuel to roll the trucks out? Or do we buy more nutritious food? Or do we invest in this program or that program? So we make tough choices as well. So my answer would be you know, a large, big donation now would be great, and monthly support would be great as well.
Okay. Got one more here. It says, are there other ways you would suggest that people can be an advocate for this issue in their circles?
Yes, absolutely. Absolutely. And that's something I didn't touch on, and shame on me, because that's one of the things that I have done, and I think particularly well, is I'm an advocate for our organization. I make frequent, not now, but I make a couple visits a year in DC, a couple visits a year in Richmond. We have our representatives that come to you know, our facilities and tour. We call them frequently. Advocacy is important, and there's a lot of work you can do and help us with policy. You know, we're dependent, our children's programs are dependent on the child nutrition reauthorization bill that it funds school lunches, and also funds our children's feeding programs, after school and summer feeding sites. So there are times that we ask, and I'll give you an example how important you can be an advocate for us. During this pandemic, for the first time, USDA allowed us to drop meals off to children and then to go to another site, where before we had to watch children consume their meal. Our foodie truck or a cafe to grow had to sit and watch children consume the meal before we could go to another site. So that really limits us, particularly in rural communities, if we could drop the meals and go. So there was an exemption made during COVID-19 pandemic to allow us to drop meals and go. What we want Congress to do is to make that exemption permanent, so that we no longer have to watch the children consume the meals. And the Farm Bill every year is another example. We get a lot of TFAP, Temporary Emergency Assistance Food program commodities through that for our agencies, since we don't have a lot of local food resources. And so, and then awareness in your circles, right? There's a lot of people that are disconnected from food insecurity in general, and they're not aware of their neighbors struggling to buy groceries, or children, you know, not having adequate food supply to be able to think or to learn, or individuals to be able to work. So, you know, creating an opportunity to generate awareness and share the story with your neighbors or with your family or with those that you know. So that's extremely important, because we still have people that just do not believe that there's food insecure individuals and neighbors in our communities. And we know that's not true. And by our experience, we know by educating and sharing the story that there are more people that will help us in our fight against hunger. So absolutely.
Well, thank you, Pam. We're coming up to the end of it here, so I don't see any more questions in the chat box. But if you do end up thinking of something to ask Pam, you're more than welcome to send your question to us by email to information@feedingswva.org, or just give us a call. We will get back to you pretty quickly with an answer to any questions that you may have. And on behalf of Pam and the rest of the staff here, I'd like to thank you for joining us in this town hall today. And we look forward to working with you in the future. Thank you very much.